Good?
I'm good.
Okay, we'll start here. Okay. So, hello. Today, I just want to go ahead and introduce Jennifer Shadle. She's now been a family nurse practitioner for over 6.5 years, and she's been treating patients with, obesity that have been overweight and has been utilizing the GLP-1 agonists throughout the longevity of that entire time. And I wanted to just bring her on today to ask her a couple more questions over the medication itself, what GLP-1s are, what semaglutide is, and just get a better understanding of how the medication now impacts today's society. And so, Jennifer, one of my first questions for you is, what is semaglutide, what is Ozempic, and what is Mounjaro?
Yes, hello. So semaglutide, Ozempic, Wegovy, those are all the same medications. Semaglutide is generic. Ozempic and Wegovy are your brand names. Ozempic is FDA approved to treat diabetes, and then Wegovy is FDA approved to treat obesity. And then you also have Mounjaro or tirzepatide, which is approved to treat obesity. They're all GLP-1 agonists, so they all act on the same receptor and have the same mechanisms of action.
Okay, and what are GLP-1s? What is it doing inside your body?
So a GLP-1 agonist is actually causing you to delay gastric emptying throughout your gut. So that in turn can help you feel fuller, decrease cravings. It can turn off food noise. And it just really helps with people who have that food noise in their head and they want to always think about what am I eating next? What am I having for dinner whenever they're eating breakfast? And also helps with portion control.
Okay, so you're saying that when you take the medication, which will actually, the next question that we'll segue into is how you take the medication and what it looks like. But when you do try, let's say, semaglutide, what can you expect to see or feel for the first couple of weeks?
So when you're first starting on it, you may or may not have any side effects or feel any different per se. But what you should notice for sure is that you're not thinking about food. You're not craving foods, especially the bad foods, foods that are bad for you. You want to make sure you are eating still all of those healthy, nutritious foods because you need to get that nutrition in, and that's always part of it. Some common side effects, so if you do experience any side effects, they're typically within the first few days after your injection. This is a once weekly injection, but it's going to be things that affect your gut because that's where it works. So mostly nausea, heartburn, maybe a little bit of constipation. And there are ways to counteract those side effects if you do experience them. You can just reach out to your provider.
Okay, that was awesome. So, Jennifer, what exactly is the dosage and how does it look?
So when you start on GLP-1, such as semaglutide, the starting dose is going to be 0.25 milligrams. And then that's going to be an injection once weekly that you will give yourself into your subcu tissue. Now, that is a starting dose. So that's what we would term a loading dose. So some people will experience some weight loss on your loading dose. Some people may not. Our goal is to get you to your therapeutic dose, and that looks different for everybody.
Okay, and what is I believe you said subcutaneous?
Yeah,
Subcutaneous?
sub-Q. Yeah,
Subcu?
subcutaneous. So that's a fatty tissue. So a lot of times underneath the arm, or your abdomen, that's probably the most common place that people will give themselves these injections, or the top of your thigh, just anywhere that there's fatty tissue.
Okay, awesome. And the next question I have for you is, let's see here. Okay, so what would cause someone to not be a good candidate for the medication? Or are there any medical health concerns?
Yeah, so that's a good question. So with this medication, if you're a female who's pregnant or breastfeeding, this is not going to be a medication that you can take while you're pregnant or while you're breastfeeding. People who have a history of thyroid cancer runs in their family or personal history of thyroid cancer are not going to be good candidates for this treatment. People with a history of chronic kidney disease will also not be a good candidate for something like this, or multiple endocrine neoplasia type 2.
Okay, very good to know. So What happens if I start taking semaglutide? You mentioned that I would go ahead and reach the dosage that would be the most effective for me. And then, I start to see the weight loss, and now I no longer really require the medication to continue losing weight because I'm pretty done. What happens next? Do I continue taking the medication? What happens if I stop?
Once you're at your therapeutic dose and that's working for you, it's also termed like a maintenance dose. So you can keep taking it at your maintenance dose. Now, if you were to stop taking it, it doesn't mean that it's going to cause you to gain the weight back. This medicine is used to supplement your new habits. So you're supposed to be developing new healthy eating habits, also taking care of nutrition and exercise. And if you keep those new habits up, yeah, and continue to focus on portion control and good foods instead of the fried fatty foods and keep active, then you should keep the weight off.
I love that. So, could you actually give some insight into some healthy eating habits and exercise habits that people should try to implement while they're also on the GLP-1 medication?
Yes. So even though this does decrease your appetite, that doesn't mean you shouldn't eat at all. You should make sure that you're eating small meals throughout the day. Make sure that you're drinking plenty of water. Because you get so full with the semaglutide on board, you may need to separate your water from your meals so that you're getting your protein and your fresh fruits and veggies in. Good sources of protein are going to be lean meats and fish. You can still eat steak and things of that nature, but I would recommend just a lower fat, so maybe like a sirloin instead of a ribeye. You can do protein drinks. Those are pretty popular to try to help get your calories in, even though that you're not really craving anything to eat. You could sip on a protein drink. And of course, at least 1 cup of fresh fruits and vegetables every day. And then whole grains. So focusing more on whole grain foods instead of just the white breads, white rice. You're looking at brown breads, brown rice, things of that nature.
Okay. And have you seen a lot of patients that come in and they're almost embarrassed of taking the medication or they fear other people knowing about it? And how would you address that? Do you recommend that they tell the people around them that they're wanting to lose weight and, be held accountable? Or what are your recommendations?
That's going to be personal for every single. I'm going to start over there. That's a personal choice for anybody, I think, who is on a weight management program, whether or not they want to share that with those that are around them. If there's somebody that does better being held accountable, maybe doing it with a family member, having other friends that are doing it with them and on board, and that's something that really helps them, then I do recommend it. You should never feel ashamed for trying to better yourself. Obesity, we're finding out, is a disease. It's not just something that somebody is. So we're treating this as a disease. It's a medication to help you, and it's there for you, and you shouldn't be ashamed of it.
I love that. It's such a good response. I also think too that we are now surrounded by such, energy dense foods 24/7. We have unlimited access to them, and it's just very hard now in this day and age to really control yourself sometimes, especially if you are someone that has always kind of struggled and have, gone back and forth with weight gain and trying to lose weight. And so with individuals that have tried fad diets in the past and have seen different, weight incremental gain and losses over time, right? They've never been able to sustain weight loss over a long period of time. How could this be different for them?
Well, because this does help turn off the food noise. And that's kind of what all of that advertising, food always being in your face, it's there to try to attract you, to try to induce those cravings. A lot of people, I'm going to stop. A lot of food manufacturers, their goal is to get you addicted to these foods. So this calms all of that down. So if you're somebody who does really struggle with that, then maybe a maintenance dose would be something you'd want to stay on.
Okay. And what about the individuals that really are super busy and they can't necessarily find time at the current moment to figure out how to go to the gym? Would you still think that those individuals will see weight loss as long as they also improve their nutrition, or is it something that needs both?
I suspect they will still see results, and in my practice, in a doctor's office, I have seen people who don't exercise at all. They get results. It's always better to exercise when you put on lean muscle, then that's going to increase your metabolism at baseline. So you're going to get better results. And it's good for your cardiovascular health. So we're all about you being healthy overall and not just losing weight in general.
I love that. And that actually segues into metabolism, right? So I hear a lot of people that are very nervous about this medication because it might impact your metabolism and your ability to process food if you were to, get off of semaglutide later on. So how exactly do these medications play into your metabolism versus just affecting your digestion?
So I've not seen anything that says that it'll slow down your metabolism. And I've not seen that, necessarily in my practice at all. If anything, this helps with insulin resistance. A lot of people who are obese do have some form of insulin resistance, which decreases their ability to process carbohydrates, which are, both your complex and refined sugars. So this should help with that, if anything.
I love that. Such a great question or such a great answer. Okay, let me see here. What do I recommend? Do I gain weight? Okay, what are the most effective strategies? Okay, so with the patients that you currently see that are on this medication, do you give any recommendations for different stages along the journey of what they should be doing or what you recommend in terms of food? Are they able to have alcohol on the medication? How does it work?
So I recommend, especially when they're first going on this or when they're adjusting their dose. So first going up on their dose to really try to control the portions and the types of foods that they're eating. That way they don't encounter as many side effects. So, what I've seen is the nausea and the upset stomach. Those side effects tend to get worse when you overeat or if you're eating fatty foods, fried foods, processed foods. So I recommend that when you go to get a portion of a meal out, get about half of what you would normally get. Go ahead and eat that. Then sit there about 10 or 15 minutes. And then if you're still hungry, go back and get the rest. Most of the time you won't be. And then that'll head off from you having too much nausea.
Okay, awesome. And what about drinking? So do
Oh,
you recommend that people have alcohol on this?
I recommend that they either limit it or don't do it at all. Because alcohol really does nothing for you nutrition wise. I understand that some people, it's a social thing. They enjoy having one or two drinks. It's never good to overindulge. That's never good for your body. And it can definitely cause you to have some upset stomach, nausea, vomiting, things like that. So I would recommend if you are somebody who feels like you really need to have, one or two drinks, then please just limit it to that and don't overdo it.
Okay, these are great responses. Are there any other things that you would like to kind of mention over how semaglutide, affects the body or recommendations for someone that might be interested, but they're just a little scared to take the initiative and actually do it?
A lot of people, whenever I've started them on it, they've had some reservations of, can I give myself a shot? Um, so we can kind of walk you through that. It's really not bad. I've had patients, get their medication, in the office when I've treated them. They bring them in and we'll show them how to do their first dose. And they're like, oh, that's not so bad. So that's mostly the biggest reservation that I see people, saying, I don't know if I could do that or not, but you could do it.
I love that. Do you actually have any examples or do you have the medication nearby so we could see how it's done?
Yeah, I just so happen to have. So this will be a syringe. This is a small insulin syringe. So it's one of the smallest. I mean, I don't know if you can see that. It's very, very small. And your medication comes in a vial similar to this. Now you'll want to make sure that you are cleansing it with alcohol prior to drawing up your medication. And on your medication label, it should have listed exactly how many units that you're to dose for yourself. So it'll say, if you can see, there's a little 1 and a little 2. So let's say you were on the 0.10 dose right here. So then you would want to take your alcohol. You'll cleanse off the top of your vial. Then I draw up to the 1 there. Okay. And then you will go, and there'll be a little rubber top there. You go straight in. You can inject the air. You will turn over, and then you'll pull back up to your 1. Okay. And you'll just wait until that fills all the way up there. Okay. And then you can take it straight out. Then you'll pick your area. So again, the most common area is going to be a stomach. And what you want to do is take your belly button, take 2 fingers, put it anywhere around your belly button, and just make sure that you're injecting at least 2 finger breaths away in any direction. You can go out farther, just no closer. You just pinch it up, and then you'll just put that in there and press down, and then you are done. I'm going to stop because I didn't tell them to cleanse the stomach with the alcohol. So where do you want me to start from for that?
Do you mind doing it over? Sorry.
Yeah, I don't mind at all. Okay. Okay, yes, I do happen to have an insulin syringe here. So here is this. It's very small. You can see the needle. It's very small, very fine. Okay. And it's got markings here. So you can see 1, 2, 3, 4. And medicine will come in a vial similar to this. Okay, your dose will be labeled on the medication label. So it will say either the 0.10, 0.20. So you'll know how much to draw up on your syringe here. You'll take an alcohol swab. You'll open it up. You'll have this rubber top here. Cleanse it off. And let's say your dose was the 0.10. So I'm going to go up to, if you can see that there, 0.10. Then you just go straight in. I go ahead and inject that air there. And then you draw up to 0.10. Okay. So you can see here with this is at 0.1. Okay. And then you will take, a lot of people use their abdomen, like I said, 2 finger breaths away from your belly button. So make sure that wherever you inject, you're at least 2 finger breaths away in any direction. It can be out farther, just no closer. Then you will take your alcohol swab, pinch up an area on your abdomen, cleanse that off, and it just goes straight in, and you'll just press the plunger down and inject the medication, and then you are done.
That was perfect. Thank you so much for your time today. That was so helpful learning a little bit more about how the medication works, that it's really just not something scary, that it is something that can take people to the next step and really help them transform themselves along their weight loss journey. We're always looking and seeking to have people uncover the best versions of themselves. And sometimes that starts with weight loss. So we appreciate your time today, Jennifer. Thank you so much.
Thank you.
Okay, we're good. That was awesome.
One other thing I thought about while I was doing this, whenever you said who's not a good candidate, I forgot to mention anybody who's ever had pancreatitis.
Do you want me to ask that question again?
Yeah, let's go back over it again.
Okay.
I think that's important.
I do too. Okay, so let me see. How did I start that one? Okay, so Jennifer, one of the other questions that we often see is who is not a good candidate for the medical weight loss?
So that's a good question. Any female who's pregnant or breastfeeding, this is not going to be for them while they're pregnant or breastfeeding. They can reconsider it after they're done with that. Other things are anybody who has had a history of ever having pancreatitis. This is not a medication for them. Anybody who has a personal history or family history of thyroid cancer, and then anybody who has a family history of multiple endocrine neoplasia type 2.
Okay, very good to
And
know.
chronic kidney disease.
And chronic kidney disease. Okay, important.
Yeah.
Okay.
Yeah.
So those are the people that aren't candidates for the program. But if you are overweight, if you are, even obese, like this would be something that would be capable of helping you lose weight.
Yes, anybody with obesity, it's indicated to treat. And then also if you have a BMI that puts you in that overweight range with another comorbidity, such as like PCOS, insulin resistance, type 2 diabetes, hypertension, fatty liver, sleep apnea, there's all kinds of those.
Okay, well, thank you. Okay, I think we're good.
Okay.
Perfect. I love this. This was awesome. Thank you so much. This was so
You're
valuable.
welcome.
Okay, I'm
All
gonna
right, so
end it.
you go ahead.
No, what were you saying?
Oh, I was like, okay, so I wanted to just go over real quick. I'm ready for Monday,
Okay.
but
Do you have it open?
do I have what?
Do you have it open?
The Google?
Yes, the calendar for Monday. Let me stop the recording now.